Mhm. Got it. Got it.
Recording is on. We'll be starting in a minute. Good evening, everyone,
Good
and
evening.
welcome to Medical Mondays with Dr. O. What a beautiful day. What a beautiful evening. I am Dr. Toyin Okwesomi. I'm a physician in Maryland, and I'm always excited to be here on Medical Mondays. So, tonight we have one of our very own, Dr. David Ajibade, who is really a spokesperson, a mouth on dementia. And I want to say that Dr. Ajibade has been doing amazing things in the lines of dementia and also sickle cell, also, autism, and, in all of those arenas. Last month, he was given an award as I think it's the best or the most
Most
accomplished,
respected,
sorry?
most respected CEO.
Most respected CEO in Nigeria this last month, January, in Africa.
Nigeria.
Correct? I want to get it right. Okay, you know what? Let's do this right. I'm going to let you, please talk to us a little bit about that to introduce yourself. I'm going to yield to you and have you again educate us on dementia, and is going to be talking again about dementia's dirty dozen. Dementia is hitting home. A lot of things are changing in our communities. We're having more cancers. We're having dementia, increased diabetes. We had Dr. Aluya last week. I mean, things are happening, and we believe in prevention because that's where we thrive the most. Mm-hmm. When we prevent, we do well. If we allow things to happen, then it becomes dicey, it becomes challenging. So I pray that we will learn some things tonight to help us to keep our mind. We are not establishing a physician-patient relationship on this forum. We are disseminating correct, cogent medical information is what we do. So without much ado, I'm going to yield to Dr. Ajibade after I greet my papa. Welcome, sir. Dr. Mike Oye, Papa Mike. Welcome, sir. You are muted.
He's muted.
He's muted, yeah. So, Dr. Ajibade, over to you.
Okay, thank you, Dr. O. Thank you so much. Good evening, everyone. Dr. O, I honestly don't know how you do it. You just came off a very busy clinic today, and you're always busy, but you always find time to do this. So it just shows your commitment to our people and people, of course, in general, just educating people on health. So thank you so much for all you do. And of course, Dr. Ajagbe too, who is always there. I don't think I've ever come on board come to do a presentation when Dr. Ajagbe is not on. So thank you so much as well.
Thank you.
Yes, sir. I really appreciate this opportunity. So dementia has become okay. Yeah, I'm going to introduce myself real quick. So yes, fortunately, I mean, I honestly at first I thought it was a scam when they when they sent a letter to me saying that I'd been selected to win their to be given the awards, most respected CEO awards. Apparently, it's a big thing. They do it in Ghana. They do it around the country, around the continent. But the category specifically was health category. So I was honored. My staff went and picked it up, and we have it on video. Unfortunately, they don't have it on. They didn't have any newspaper clippings and all those things, which would have been good for my immigration status. But well, that's what we have. For the Africa, I won. Our TV show won the best health TV show in the whole of Africa. That was 2 years ago. So so that one was another award we won. So like I told Dr. O, a lot of the credit goes to our staff and the volunteers. We have lots of volunteers, young people who are so enthusiastic about helping children, helping adults, disseminating information that they come of their own volition. And my apartment now is always full of young people. Of course, we give them free refreshments, but they're just excited to be able to do something. And I think one of the problems in Nigeria is people don't have something to do. Something, they don't have a purpose, they don't have a mission to be engaged in, and that's why they end up doing a lot of other bad things. So I'm just glad that in our own little part of the world, we can provide a mission or a passion for young people to come around and to interact and to see results and be fruitful in what they're doing. So again, thank you for this opportunity, everyone. So we're going to be talking about Dementia Dirty Dozen. Let me see, click this. I hope everybody can hear me okay.
Yes.
Great. So just want to leave. Thank you. So just want to leave this out briefly. The Alzheimer's Association is a very wonderful association. I know I'm putting a plug in for them, but they offer their services free of charge. If you have anyone or close to you that or a loved one you're concerned about, you can call them. They will point you in the right direction. They will even provide maybe show you where you can get legal services or planning or whatever it is that you're concerned about. They can point you, and they are 24/7. That's their phone number. Okay, I've said a little bit about me. As Dr. O said, dementia is beginning to explode. It was already on the rise, but it was mostly seen in developed countries, like the USA, UK. In China is like the number one. It's up there now. The UK is number one. In Australia is number two, but it's number one among women. So in the developed world, we know for sure it's a big problem. However, we're now beginning to see that in the developing world, sub-Saharan Africa, the Arabic countries, we're beginning to see a steep rise. And what has happened with COVID is that it has pretty much turbocharged that rise in the number of incidents. And the troubling thing is this, in my opinion, is very troubling, is that we keep on focusing on just one piece of the puzzle to the exclusion of other possibilities on how to possibly prevent it, treat it. We're all focused on just one part of the puzzle. And I think that, and even if we get it right in the developed world, from what I see, once they get that drug that can remove the amyloid plaques, before you translate it into places like Nigeria and West Africa, first of all, the cost is too high, but then you need the expertise and the specialists. These people need to be treated in the hospital, where there's all the different equipment that can help, that will be available to help treat them. We don't have that available. So what is needed, in my opinion, is an approach that helps people wherever, whether they're in developed countries or developing countries, where they don't have access to all this wonderful gear and equipment and medications, but they can do something to prevent it. And even when they start having the problem, they will be able to take the right steps. And that's one of my passions. Really, what are those basic things that we can teach people or we can provide for people, put in their hands that they can use, rather than just say, well, we're waiting for this. Just hang on, hang on. I feel like we're in a holding pattern. Hang on, we're waiting for the cavalry is coming. When we get the right drug, then we'll make the drug available to you. But until then, just hang on. And that's the way I see it is happening. And unfortunately, more and more people, and this is crushing and destroying lives. So that hope is not a strategy as far as I'm concerned. So this is still, what I have in front of you is that this is still the prevailing wisdom, is that Alzheimer's disease is the only one of the top 10 causes of death that cannot be prevented, treated, or its progress slowed down. Fortunately, that's changing a little bit, but it's still like once you get it, the death clock, the death ticker begins. So by 10 years, you're out of here, no matter what you do. That's the prevailing wisdom. Once you are diagnosed, that's it. And we're now beginning to see that is not exactly true. I just want to point out here that the highest risk, we know that there are 3 specific groups that have the highest risk of dementia. Now, when I say highest risk, they are at least twice as likely to have dementia as the rest of the population: military veterans, Black people, and women. So if you are a woman who's a military veteran and you're Black, extra problems. And I've actually met someone who actually is beginning to have the first signs of dementia, and she's actually a kidney patient. A kidney patient. She's actually undergoing dialysis, so that's an issue already. We'll talk a little bit about African Americans and why, maybe why that's why it's so big among African Americans. But I want to really focus on the basics and why that is so. So this is the outline. I'm going to say a little bit about dementia, the best definition of dementia, because unless you have clarity about what a problem is, you really won't be able to prepare to defend yourself against it. You won't. Sorry, there's a little bit of background noise. Is there any way we can possibly mute? I keep hearing this background. It's a little distracting. Thank you very much. So it's important that we know clearly what something is and what something isn't. And the more empowering the definition is, the more we will be able to act and make the right decisions per second, per scenario. So we're going to talk about what is known as dementia's dirty dozen. Then I'll mention a few things. I'll also talk a little bit about why Blacks have it worse, and hopefully we'll get done in the shortest possible time. I showed this picture. I believe I showed this last time. This is Bob Hope. He would go around the world during World War II, I believe, and he would go on entertaining the soldiers. And one of the things he liked to do, he would bring a beautiful lady, very scantily clad, have her walk across, do the catwalk, and they were mostly men, obviously, at that time, and they'll be like crazy, just oogling her and all that. And he would say, listen, man, take a very, very close look, because this is what you are fighting for. That, of course, they would go crazy. I'm like, yeah, we're fighting. We're going to kill those people. We're going to kill the Nazis. Anyway, my point is this. This is what you want to take seriously from the very beginning, from whatever point or stage in life you are, especially if you are Black. You want to start taking a special care of your brain, because on the right is what's going to happen to your brain if you have Alzheimer's disease. God forbid, not you, but your enemy, or time. On the left is the healthy brain. This is how we want our brains to remain until the time of death, nothing less than 90 years of age, in my opinion. Can someone say amen? All right. So that's what a healthy brain. Amen, Ma. Thank you. That's what a healthy brain should look like. At worst,
we were muted.
I received. Fantastic. Thank you very much. At worst, the aging brain shrinks by 10% at worst. But with Alzheimer's disease, it's over 30%. Over a third of the brain is lost. That is a lot of brain tissue. So we want to know what it will take to avoid such circumstances, such a situation. So that's a healthy brain and an aging brain. It's not just about memory loss. I think too much of the time the focus is on memory loss. It is more about brain failure, because I mean, look at this picture. I mean, is it just memory loss that will cause a brain to shrink this much? Of course not. The memory is the memory center specifically, just a small part of the brain. So even if they were obliterated, the brain would not shrink this much. It is total brain failure. The brain is dying. In fact, in a movie, the lady is called Still Alice. Still Alice. I am Still Alice, in other words, but the movie is called Still Alice. And it was very well done by Julianne Moore. And Alec Baldwin was there as well. That's before he mistakenly shot somebody. One of the most poignant parts of the movie was when she said she was just so frustrated, and she just shouted out, and I'm effing dying. My brain is effing dying. I'm alive, but my brain is effing dying. And she kept on saying that. It was very, you felt the pathos in her voice. Okay, so dementia, people ask me all the time, what's the difference between dementia and Alzheimer's disease? Basically, they're the same thing. Alzheimer's disease is a subset of dementia. It's a very large subset, about 60 to 80%. But we're now finding out that it's not that Alzheimer's disease, what we call Alzheimer's disease, is really a mixture of different dementias. We just like to use the term Alzheimer's disease because it's convenient, but really it's a mixture of different kinds of dementias. This is what we've been made to believe as doctors, as healthcare professionals, as lay people. Basically, it's essentially this: Alzheimer's disease is a degenerative brain disease that is caused by certain proteins, mainly amyloid and tau, that mysteriously appear and multiply throughout the brain. Critical mass is reached, at which point the brain begins to shut down or die. Eventually, the individual dies, the body of the individual dies. It is invariably fatal, invariably. So you can see that there is not much hope that is given. We don't know why the plaques appear. We don't know why the tau tangles misfolds, but when it happens, begin to put your affairs in order. That's essentially what they say. Obviously, if you are in a developed country and you have good social services, those will be provided. You have nursing and so on and so forth. Obviously, those are not available in Nigeria or other sub-Saharan or third world countries. Now, this is a definition I really like by the Alzheimer's Association because it gives specifics. Alzheimer's is a degenerative brain disease that is caused by complex brain changes following cell damage. It leads to dementia symptoms that gradually worsen over time. And that's the key there. There is cell damage. So that opens things up. Okay, what is causing this cell damage? Where are the attacks coming from? And so that's what we're going to be talking about today. And I have this graphic here. It's basically saying cell damage. Once there's cell damage, it's basically depicting what the definition says. There's got to be cell damage. There's got to be compensation by way of complex brain changes. Then eventually there's inability to compensate. The brain begins to degenerate and die, and you get symptoms. It's usually about the third stage that you begin to have the first signs, actual first signs, like memory problems. But I can tell you for a fact, there are many signs that happen that people don't notice, like sleep disturbances, not being able to sign your signature, for instance, or not being able to spell certain words that before you could spell them, or not remembering certain names that before you could know them. Those are just you can chalk them off to old age, but we're beginning to see the signs. Even things like hearing loss or smelling disturbances, we're now beginning to see, especially after COVID. There are now neurologists who are looking at patients older patients who had COVID with loss of smell, and they're seeing an acceleration in their cognitive impairment after COVID, just from the COVID virus itself. So we'll point at that itself. So where's the damage coming from? I'm just going to skip through these. I've classified it, and I believe I mentioned probably this before, but I've classified this into 12 areas where the damage is coming from. Some of it are outright attacks. Others are a result of fewer protections. As a matter of fact, here's what we found out.
I'm going to come back all to my class. I have an 8 o'clock meeting. I'll go and come back to. I lost my class.
Okay. So if we're to summarize things in three reasons, and there are only three. The three main reasons why people come down with dementia are: one, over the course of their lifetime, their brains sustain greater attacks. Number two, they have fewer protections or weaker defenses against these attacks. And number three, when things begin to happen, when their memory of their cognitive processes begin to stumble or falter, they are not being given the prompt, appropriate medical attention, either by way of investigations to find out what's going on or the right treatments to actually nip that thing in the bud. So again, there are only three reasons. One, greater attacks. Two, fewer defenses. And three, lack of prompt medical attention. This is what applies whether to women or to the military, veterans, or to Black people, or to whomever whoever comes down with dementia is due to those three things. But what we've tried to do is that we've tried to expand it into 12 areas so you can know precisely what those categories are. So here we go. And I tried to make them, I've all used the letter I for them. So here are the dementia 30,000. I'll go over them in turn. But the most obvious one is illnesses, and it could be a metabolic problem, or a cardiovascular problem, chronic disease like diabetes, psychiatric, mental health, or neurological. I've mentioned smelling problem, loss of smell, because of this, the olfactory cortex, where smell is processed in the brain, is also the part of the brain that produces new cells for the brain. Up to now, I don't know why it's still an argument, but many doctors still insist and maintain that once brain cells are damaged, you cannot regenerate brain cells. That is simply not true. The brain is always, every single day, making new brain cells, and you can improve the ability of the brain to do that, given the right circumstances. And so back to the olfactory cortex. The olfactory cortex, or the smell center of the brain, produces new brain cells. And if it is damaged, you can see how it can most likely or more possibly lead to dementia, because once there's damage, there's complex brain changes, and then there's degeneration, as we said earlier. Hearing loss too is a big thing. There's a clear correlation, very clear correlation between hearing loss and dementia. They just haven't been able to find the exact pathway, the exact mechanism. So they've not been able to establish that it's causative, but there's very, very clear correlation, just like cell phones. There's a very clear correlation between cell phones and some kinds of problems. I'm not going to mention them here. They just have not put it out that this is the pathway. So I want to really encourage you as much as possible. Do not put your cell phone to your head, and certainly don't give it to a kid under the age of 12 to be using on a regular basis, especially these smartphones. Okay, and then here's a slide saying hearing loss and dementia. Okay, the next one is injury. This could be anything from road traffic accidents to the blast injuries that soldiers face when they're next to artillery or gunfire. They hear this. It's not just the noise; it's actually the impact, the blast impact on the brain that causes minor injuries. Same thing with there was one I was going to mention now, the football players. This is Super Bowl season. A lot of these people are actually having these minor problems. They think they're minor, but 20 years, 30 years from now, many of them begin to have symptoms and signs that could possibly lead to dementia. Another thing is insults. A lot of these things going on. I don't know if you've been on the news lately, but Black women, Chicago, there are lots of lawsuits against these hair care product companies because they're beginning to discover, I know this is crazy, they're beginning to discover that the chemicals that are being put in relaxers, in hair relaxers, have been directly shown to cause things like ovarian cancer, uterine cancer, and so on. And so there are lots of lawsuits, probably going to spread to Maryland as well. Trust me, if they're seeing a correlation between hair care products, the chemicals in hair care products and cancer, you can bet your you know what, that there's going to be very clear correlations between hair care products and dementia. As a matter of fact, they're beginning to show those things. But now cancer is more glaring. So they are concerned about that. That's what we see on the news. But trust me, there's that. So and again, this is not to scare women. I did a presentation on this last week on a Black women's network, and I mean, I had to be very sensitive about it to say, oh, this is the situation. Now, we're not saying you should not do your hair, ladies. Please don't get me wrong. The whole idea behind this study is for you to be aware of the threats that are out there and make your own intelligent decisions, what you need to do. Maybe you might need to take a holiday, a week off, 2 weeks off, whatever it is. But at least the bottom line is that you should be aware that's everything. It's not everything you do to your hair and your body that is safe. And so you want to mitigate the impact of those things. Alcohol, Tooth problems is another thing as well. These silver fillings have mercury in them, and they don't stay in the tooth. Let's just leave it at that. Personal care is another issue. So, I mean,
Dr. Ajibade.
We have to wait, please, till Q&A. We have to wait till Q&A.
No, because he mentioned tooth.
We have to wait till Q&A. Yes. Thank you.
Okay, so personal care products, imbalances, that's another I, especially where women are concerned, especially at the time of menopause. When at the time of menopause, estrogen levels begin to plummet, and so do progesterone levels plummet. What happens, and these two hormones are extremely important. In fact, estrogen is the most important hormone they found out for the protection of the brain, especially the synapse, where the two neurons come together and where there's interchange of signals and information. Estrogen protects that coming together. And what they're finding out is that once estrogen levels drop, that protection is lost or is not as robust as it used to be. But here's another thing: progesterone also protects the brain, and progesterone even drops even further. So there's something called estrogen dominance, which means that there's more estrogen than progesterone, and there's an imbalance. And that imbalance on its own can result in many of those problems that we see. So it's not just that there's less estrogen, but also there's an imbalance between estrogen and progesterone. Those two factors can lead to many of those symptoms we see or hear about or experience. Brain fog, sleep problems, night sweats, and mood irregularities, and so on. Those are all issues that can eventually, in the more susceptible, lead to dementia. A big thing with insulin resistance, but let me just quickly define it. Once your body cells are now responding to insulin, which insulin is used to insulin is like a key that opens the door for your cells to take in glucose. If insulin is not there, or if the cells are not responding well to insulin, the door remains closed, so the glucose cannot get into the cell, which also means that the glucose will begin to rise in the body and in the brain. And we all know what happens when when glucose begins to rise. It causes problems, especially in the memory center of the brain. I mean, the memory center of the brain, the hippocampus, is probably one of the most sensitive parts of the brain, and that's why it's always implicated in many of these conditions. I'm just going to go on here. I mean, again, this is just each of these can take like an entire day or more to treat, but just pointing out some of the essential things that we're trying to talk about. People think we don't think about stomach problems or intestinal or constipation being a problem, but I can tell you this: some of the subtle signs that can lead to dementia, that point the way to dementia, things like constipation, because the guts and the brain they're like 6 and 7, they're so well connected. So if something happens in the gut, it can happen in the brain. I just want to say this real quickly. Those of you who are taking acid blockers and H2 blockers, what are those called again? PPIs and
proton pump inhibitors. Those are PPIs and H2 blockers.
H2 blockers. Anything
like
that
Pepsid, H2 blockers are Pepsid, Zantac. Proton pump inhibitors are things like omeprazole, pantoprazole, and the likes.
Exactly. Thank you, Dr. O. These are not entirely safe. As a matter of fact, used over a period of time, they are now beginning to have some major implications, amongst which, because you've got to realize, and now they're saying it's not the problem. The problem is not that it's not the acids in the stomach. In fact, in some cases, they're saying it's because there's too little acid that you're having all this gastroesophageal reflux. Not enough time for us to go through it now. But the important thing is that you want to look for safer alternatives rather than using it for 20, 30 years going on. I had a patient who for 40 years, Dr. O, had been using these blockers, these PPIs and H2O blockers. He came down with dementia. And he could, and when you now go into his history, you see that he had been using this for such a long time. This is a person who is otherwise very healthy and otherwise very fit, and he was financially well off. So there was no problem, but we could see, that was the main thing I saw in his history. And I was like, this is what is happening. Another thing that these acid blockers do is that they prevent you from absorbing vital nutrients like vitamin B12. They block the absorption of these things. Vitamin B12 is critical for brain function. Once you're lacking vitamin B12, instantly your brain begins to deteriorate and degenerate, especially what are known as the myelin sheaths that cover the nerves. So, and I understand over 10% of the population are actually on these pills, and that is scary. Another thing you want to, and I'm going to throw this out free of charge too. Another thing you want to avoid, you don't want to keep on using, and Dr. Ajibade, I hope I don't step on your toes here, but you don't want to be taking a mouthwash. A lot of these mouthwashes are blocking nitric oxide production in the mouth, and nitric oxide is crucial, not just for the brain, but also for the cardiovascular system. All right, so there you have it there. Infections, I mentioned COVID-19. There's other viruses like herpes virus. There are some bacteria in the mouth that if you don't have good, proper dental hygiene, those bacteria can get into the bloodstream and basically go into the brain and camp and set up shop and just hide there for 10, 15, 20 years. And then once your immunity begins to drop, there's a resurgence. The problem is that resurgence is in the brain, and it can wreak a lot of havoc in the brain, causing damage. Okay, so to infections. So we've talked about some of the things that can attack and damage the brain. Let's talk about the things that can protect your brain. Remember, number 2 is that people who come down with dementia have weaker defenses or fewer protections. So we're going to talk about the protections that are available. Okay. Inactivity is to protect your brain. Physical activity, especially if you're over 50, as I am, you need, no matter what else you're doing, whether you're walking or dancing or whatever it is, you absolutely need to be doing some sort of resistance training that stresses the muscles. I have so this is what I do. I have this. These are just like bands, right? The bands, I don't know how well you can see this, but can you all see this? This is a bar, and then these are bands on either side. So what I do is like a ritual or a routine. Before I get into the shower, I just try and do like 50. Sometimes I push to 80. I mean, I just do it because it's a religious chore. I don't really like doing it, quite frankly. I prefer to play squash. But ever since I began to understand how important muscular strength is to brain health, I realized that I would be a hypocrite if I didn't start doing it, since I talk about it so much. There's a direct correlation between when the muscles are stressed and improvements in or the generation of certain brain chemicals that help to improve the brain. These brain chemicals are called myokines. So walk regularly. Do any kind of exercise. Don't sit down all day long. I promise. Sitting down itself is a big problem for those who are even at work, sitting down behind a computer. But you need more than just moving. You need to stress your muscles. And there you have the elder. So I go to a lot of senior centers. Of course, the more well-off senior centers are mostly whites, and they have very good gyms there. And you see the 90-year-olds going to the gym and working out. It's not as much a practice amongst the Black folks or even those of us in Nigeria, but I'm hoping that we will encourage that more and more. Inadequacies, insufficiencies, I kind of touched on it. I've touched on vitamin B12. Of course, you know me, I'm going to talk about vitamin D. So this is something I've probably said before. These are the top 7, in my opinion, the most basic things, the absolute most basic things that your brain has to have on a regular basis. Looking at this list now, I realize this thing could cost you over $100 really to get it. So we are working on, we're working on making it possible to have the most important aspects of this in one package, about 20 of them. So we're working on getting that together specifically for the Black person. because what the Black person needs is different from what the white person needs. Is different by way of amounts, form, concentrations. In fact, there are some things that they're okay for the white person, some nutrients they're okay for the white person to have, that for the Black person, not so good. And this isn't being talked about. And to me, it's shocking. So there are some nuances that are involved in getting the right combination of nutrients for the right race or the right person. Again, Black women are different as well. But from what I've seen, we've been able to put together something, or we're putting together something that is safe and effective for Black people in general. Vitamin D, of course, I'm just going to say a few things here. 40% protection against dementia. Those who have ample levels of vitamin D. And by the way, please don't do that. If you go to your doctor, make sure you check for vitamin D. And if the doctor checks you for vitamin D or does a full checkup and they say, oh, your vitamin D levels are okay, don't accept that. Ask him specifically, what is the number? What is the number? I mean, why? It's like people say all the time. I go and ask people. They say, "Yeah, I checked my vitamin D. Okay, what is it?" And the person says, "Oh, the doctor says it's just okay." What does that even mean? Because the range is like 30 to 100. That is the range. Are you going to say that because you're 30, you're okay? Now, brain scientists and people who actually treat dementia, and I'm one of them. I treat dementia in Nigeria because I'm licensed in Nigeria, so I have patients who reach out to me and we treat them and we get some really good results. Most brain doctors who actually know what they're doing and treat dementia, they say they don't accept anything less than 100. So think about that. You have a wide range, 30 to 100, and most doctors will say, in fact, if you say 28, 29, you're fine, they'll say you're fine. That's ridiculous. That's only good for bone health. But when it comes to brain health, you can imagine that the brain is so much more complicated than the bones. So you're gonna need a lot more. Anyway, I want to get off my soapbox. But the point being this, you need to be more educated and more enlightened and be more responsible for your numbers and for your health, because your doctor is not going to be the one to do it. He has too many things, or she has too many things to deal with. They're not going to be that concerned about your vitamin D levels. I promise you, but you have to be. Okay, sorry, I just get all. If I was a white person now, my face would be red, because I'll be so irritated by this thing. Anytime I think about it, I just get upset. Okay, here are some of the things that I'm just going to get. Yeah, so, all right, I'm not going to read this out. Bottom line is that the brain, as you're listening to me now, your brain is constantly changing. Your brain is always changing. It's forming new synapses, new connections. It's breaking down old synapses. So it's constantly just sending branches and retrieving branches throughout the brain. Now, it may seem haphazard, but it isn't. It is building these synapses and these connections. It's laying them down on what are known as scaffolding. You know what these things these support structures on outside the buildings. They're like scaffoldings in the brain that show and direct how these networks are created and laid down. It is these are called perineural nets. I'm using scaffolding as a colloquial term, but these are called perineural nets. They act as the scaffolding of the brain. Vitamin D is what maintains the scaffolding of the brain, amongst a lot of other things that vitamin D does. So vitamin D deficiency, and we all know that Black people are the most deficient in vitamin D, right? But vitamin D deficiency really reduces the integrity of those scaffoldings. So let me see. Okay. I mentioned that 40%, if your vitamin D levels are optimal, you can actually reduce your risk of dementia by over 40%. There's a big 7 again. This is Black History Month, and people are talking about Black Lives Matter, and they do. But we also have to talk about Black Brains Matter. It's been a little disappointing to me how few I've reached out to Black leaders and doctors around the city. I'm like, we need to do something about this. And it's like, yeah, whatever. just thank God people like Dr. O and Dr. Ajibade and a few of the doctors on this call are in support of what we're trying to do. But Baltimore is number one. I know not everybody on this call is number one, is in Baltimore, but no, Baltimore is number one in the country when it comes to dementia. Maryland is number one in the state, among the 50 states when it comes to dementia. And the most number of Black people with dementia are based in Baltimore and Maryland by extension. So we have some work to do. Well, let's move on. So sleep is another thing. I mentioned it to you before. Sleep is very important for recovery and for repair and for detoxification. If your sleep is distorted or compromised, that's the word. If it's compromised in any way, you can significantly increase your risk of dementia. By the way, sleep, lack of sleep raises amyloid levels. We talked about that earlier. It raises amyloid levels in the brain. Isolation is a scary one. I did not know this. I'm a bit of a loner myself, so I tend to like, this is scary to me. This is a quick quote. I'm going to read it out. We cannot live only for ourselves. 1,000 fibers connect us with our fellow man, and along these fibers, as sympathetic threads, our actions run as causes, and they come back to us as effects. We affect each other. We know this, and this is I gotta say this. We know this even in the dorms, in the among kids. We know this. I heard a doctor, a neurologist, talk about this, and I just saw it among 3 of my friends. Females living in the dorms, maybe in college and all that. After a while, they all in like 3 or 4 of them in a room. After a while, their menstrual periods all synchronize. And they all have the menstruation at the same time. And it's usually the most hyper or the most outwardly going or the most extrovertish of them that they synchronize to. So it's about energy, right? I actually saw it with three of my friends in Tulsa when I was living in Tulsa. They were all together, three ladies, and eventually they all synchronized. And it was the youngest of them who was the most high energy that they all synchronized to. Amazing, but bottom line is that we affect each other. And once you are not having good quality relationships and you're not enjoying the companionship of others who are near and dear to you, you do run the risk of all sorts of problems, including dementia. So here you have in red here, it says social isolation contributes to human brain atrophy and cognitive decline. These are studies that are coming out of Duke. The socially isolated have decreased ability to learn and make decisions. When you're socially isolated, you are at greater risk of developing memory problems. That is scary. All right, this is the last one, immune dysfunction. The immune system is what protects your brain and what protects your body from invasion by viruses, bacteria, and so on. But the immune system too can go haywire and begin to attack your brain. And that's what we see in autoimmune conditions. So it's important that your immune system is level-headed, so to speak, is balanced. And that takes a lot of important things. It takes proper sleep, it takes a proper nutrition, vitamin D again, amongst other things. It takes lack of stress, it takes good relationships. So yeah, I'm not going to tell that story, but if we have time, I'll tell you the story about the stupid mice. Another eye, this inflammation was one of the dirty dozen, but when I heard about isolation, I was like, nah, inflammation, we kick inflammation out, we put isolation in place. Because inflammation is global, all the pathways results in inflammation, inflammation of the brain. So I was like, yeah, we can take inflammation out, and then we can talk about it as a final common pathway. Okay, so I've talked about this. African Americans, why do they have the highest risk? Again, it goes back to those 3 things. Blacks, we African Americans have the highest levels of attacks, greatest attacks. Again, part of it, of course, if you are born and raised in the US as an African American, you can understand that more when it comes to racial problems. I'm not going to dwell on that, but certainly that adds to the stress especially if you live in poor neighborhoods and you don't have access to the things that you need to have access to. But it's not only that. There are genetic factors, there are lifestyle factors, there are dietary factors that we can treat on a normal day. So here again, they are. So these are the diagrams, brain changes. So I think I wanted to just point out one or two more things. Oh yes. So at the Brain and Body Foundation, we were given authority by the federal government. We went to the Ministry of Health. We tendered before them, put before them, or we set before them our approach to brain disorders, whether in children or adults. They saw the results we were getting in children and adults. They gave us special dispensation, so to speak, to address brain disorders using our approach, which is called the building strength approach. So we like I said, I do a lot of telemedicine, and we still treat patients in Nigeria. But those who are not based in Nigeria, we let them know they have to sign waivers to let us know that we are not treating them as doctors here. We can give you health coaching advice and point you in the right direction. But to cover we basically I'm basically operating as a health coach here. However, there's a lot that still can be done to help people, not just here, but around the world within the limits of the law. So let me end by this. The secret of successful aging is a healthy lifestyle, staying physically active, cognitively active, and socially active. This helps the brain continue to be plastic and the number of synapses in the brain to grow and the number of neurons in specific areas to increase. We have more control over this than I can't see what was at the bottom there, man, than we realize, I guess that would be the word. So that's it. Okay, I have my information here, just in case you want to reach out to me. So Dr. O, thank you so much for your time, for letting me again for this wonderful platform. And I think I'll just open that up to questions.
Wow. Thank you so much. This is a lot. I have questions. But you know what? Before I ask, Madam VP is going first. Because she was right. I had the same instinct she had. Immediately you said something about mercury in tooth filling. I was going to ask the question. I was going to say, Dr. Ajagbe, you got input here. But Dr. Ajagbe takes it. We're not going to end our lecture at that time. So, Madam VP.
Yes, ma'am.
I see you. Kindly ask your question and give your input, please.
Well, yeah, I want the jury to ask Dr. Ajagbe.
Dr. Ajibade, please put down the slides, please.
Yes.
So, thank you. Yeah, thank you.
You know, because a lot of people that have had dental work, you know, like me, we had no idea. So I don't know if FDA is supposed to have been involved in this, but many people are not aware of the
effects of mercury.
Yes. And, you know, I didn't know that, you know, sometimes last year, Dr. Ajagbe gave us some free diagnosis. And one of the results that in mine is that I have excess mercury. So now what do I do now? And I thought it's from fish, but now I didn't realize that it could have been from my tooth, because I think I have one of those. So what do we do? Go get it out? Stop eating fish? What?
Madam VP, I'll
Yes,
let Dr. Ajibade answer the question about the fish. Since we have an expert dentist on here, he would answer the question on mercury, but I don't think we have anything to worry about that. That's just my take. Dr. Ajagbe would dispel that if I'm wrong. So, Dr. Ajibade, fish, is that where the mercury came from? Or the mercury in the tooth?
Well, I wouldn't know where the mercury came from in her case. But yeah, a lot of fish have a lot of toxins. And it's not just mercury we're concerned about when it comes to eating fish, especially farm-raised fish. There's a lot of mercury, but also a lot of parasites, especially if you're taking sushi, you know, and all those things. So you just want to be aware of and be cautious about it. They say you need to take a wild caught Alaskan salmon, but of course the price with the number of qualifications, the price goes higher and higher and higher. Wild caught Alaskan salmon. Can imagine that's a lot of things. So there are people who have been wanting to be very healthy, they want to avoid meat, and they eat a lot of fish, and eventually they come down with a lot of mercury toxicity. So you want to avoid that. There are things that can help on a daily basis to reduce your toxic burden, the toxic load. That can be discussed on another platform.
Another platform? Can you give us ideas?
Can I please,
please
a follow-up question?
Yeah,
because those of us from Africa, we have alternatives when it comes to eating fish. There's the smoked fish, dried fish. Is that any better than the fresh fish in terms of the contents of mercury, or does that even come loaded with other stuff? Because the process of smoking it or whatever, I don't know.
So the challenge with smoking, especially if you're talking about the ones that we talk about the ones we eat in the garden, where you put in the aluminum foil and you really cook it. Is that
the ones in the market? No, sir. The ones in the Ajibade.
Okay, Ajibade. Okay. I'm not too familiar with that. I know the ones in the garden, that's another issue because of the aluminum foil. Smoking increases, if I'm Dr. O, correct me if I'm wrong, but it increases certain toxins called nitrates and all that. Maybe not, but I would say that
it does.
It does, Abby.
Yeah, it does. Dr. Ajibade will talk more about that. He has his hand raised. I'm waiting.
Okay. Yeah. Okay. Well, when I say another platform, Dr. Oye, just to quickly point this out.
Yeah, please.
When I talk on other places, there are strict rules about mentioning certain products and all those things. That's why I said another platform. But if you want me to go ahead and say it, there are certain chemicals.
Yeah,
there are certain supplements that I've been using for kids, especially kids with autism, who have a lot of toxins. So I'm very familiar with how to control levels of toxins. They're called zeolites, zeolites, zeolites. And these are made from, I've already mentioned it before, they're made from volcanic ash, the minerals from volcanic ash. And essentially what they do is that they're very safe. They basically just attract chemicals and heavy metals from the blood, and you end up peeing them or going out in the poop. Safely, so it's not harsh on the body like some of the other activated charcoal, other things that people use to detoxify. This is something that I use them on kids that are 7 months old, 8 months old. Very, very safe, and it can be used for pregnant women as well, from what I've seen. So these are some of the things that we encourage, especially if you are thinking about getting pregnant, or you're thinking about, or you have a kid that has autism. We try to improve. We give them these things so that they can reduce the toxic burden, which of course can cause all kinds of problems. So
for somebody who, has been tested as elevated mercury, the zeolites would help to pee it out, basically.
Yeah.
Okay.
Yeah.
Thank you. That's very important to know. Thank you. I appreciate that. Dr. Ajibade, you have your hand raised, sir. Sorry for for keeping you waiting. We too were waiting. Go ahead,
Dr.
sir.
Ajibade.
Yes, sir.
Thank you so much for the presentation. I warned you ahead of time that there's no way you can dodge vitamin D discussion.
Of course.
Anyway, let me address the issues. The first one is the mercury in fillings, or the mercury in what we call the silver amalgam. The silver amalgam has been tried and tested over at least maybe about 3 centuries, and it's still being found both by WHO and FDA of the United States of America to be safe. That it has not been found to be associated with any degenerative disease. Yes, there are people who are going about fighting fighting amalgam as though it is by itself. Now, let me help us to understand the reason why the feeling in the mouth is safe. Two reasons. One, when you triturate, that's what we describe the process of mixing amalgam, mixing the alloy powder with mercury, which is liquid. When we mix them together in a mortar, manual, what we are doing is actually activating a chemical physical reaction. When the alloy contains of silver, tin, and copper. Those three metals, they're like filings. They are mixed with mercury, which is liquid. It will form something which is moldable. The only time you could ever be exposed to any form of dangerous mercury in dentistry is when mercury liquid spills. If mercury spills on the ground, you cannot gather mercury once it spills because it rolls into spherical balls and you cannot gather it back together. So in the dental environment, that has been completely eliminated by having capsules. The capsules are now used in special machine that triturates the mixture to make sure that there is no excess mercury available. So if you don't have liquid mercury, you cannot have high heat enough to generate the vapor. So in dentistry, research data is a lot to kind of allay the fears about mercury. That is from the standpoint of when you first use it. Now, let's say people have had their amalgam filling for 15 years, for 30 years, for, even 40 years. What are the dangers? Is it directly related to causing any degenerative conditions? The answer is still no. There is none. There will be some outliers that will say, oh yeah, I know, because the only thing I can say is wrong is that there was a mercury or there was a person with a lot of mercury fillings in their mouth and they develop Alzheimer's disease. That is not the case with the general population that have mercury amalgam. I don't do amalgam anymore. I haven't done amalgam filling for the past maybe 15, 20 years. Not because of the danger of the mercury in the filling itself, but because there are competitive, futuristic materials available, not only cosmetically acceptable to the patient, but because they are easier to use. So in that case, amalgam is kind of easing out of the way. From our own experiment and from our own experience in dentistry, and I've been in dentistry for 44 years. So I know this for a fact. There is no stronger filling material that is used chairside in dentistry that is stronger than amalgam. In fact, amalgam will outlive most people's teeth. Because if it's well done, the amalgam will outlive anybody's tooth. Because when you are cracking the tooth around the amalgam still stays strong. So amalgam itself does not pose any risk. And I can say it again, you can search the literature, there is no obvious risk that is attached to amalgam filling. I'm not talking about mercury. Mercury by itself is dangerous. Mercury by itself can only be dangerous in an industrial environment where they're using mercury to process so many things. The reason it's dangerous is because it becomes vaporized at certain temperature. It is the vapor of mercury that causes problem, not mercury liquid by itself. The liquid mercury itself does not pose any major health hazard unless it's ingested. Most of the danger that's associated with mercury in physical form has to do with the vapor. You cannot generate enough vapor in dentistry for the patient to be exposed to undue risk from the amalgam filling. Now, amalgam filling that is an old one that you want to remove, research has also proven that you cannot separate mercury from the amalgam filling just by removing the old filling. You cannot. And the reason you cannot is when the amalgam is being removed, there is a jet of water that is flowing at high speed that will not even allow any vapor of any sort to be inhaled by the patient. And not only that, we have what we call the high volume evacuator, which is the suction, which is a heavy duty suction that takes away everything that is being, cleaned out of the tooth into the suction. So I'm emphasizing on all of these things so that people's fears can be allayed. You don't have to worry if you have an old filling in your mouth. You don't have to go and rush to take it out if it's not defective. If it's defective, of course, you have to change it. But if it's not defective, leave it alone. It will be there. Keep it clean, keep it smooth, keep it shiny. Everything will be fine.
So, Dr. Ajibade, your take home, the mercury is formulated into the substance amalgam that does not expose the person's tooth or the person whose tooth is being filled to mercury. So
yes,
because I have other questions, is why I want
to. So that's the summary of that.
Thank you. I appreciate that. So, and you have educated me on this before, so I was so excited to hear you, re-educate us. Thank you. I appreciate you, sir. So
you want me to say something about the fish too? I shared it before.
Yeah.
Here.
Yeah.
Platform.
Yeah.
Yes, different fishes have different levels of mercury. The smaller the fish, the less the amount of mercury they contain. When the big fishes consume large volumes of smaller fishes, they concentrate the mercury they contain. So the higher concentration of mercury varies based on the size of the fish. The biggest fishes will have very high level of mercury because they consume a lot of smaller fishes. So if you're going to look for the fish that has the least mercury, you're looking at the anchovies. Anchovies are the tiny fishes, the tiny fish that we call yo-yo in Yoruba in Nigeria. They are very small. That you can have 1,000 of them for one meal because they are so small. They are safe from the standpoint of mercury. Okay, so if you are of the kind that love all these expensive big fish like swordfish, like mahi, like barracuda, all those big fish, you are exposing yourself to higher levels of mercury. Yes, they may be delicious, they may be expensive, but in most cases, you are exposing yourself to higher mercury. And I think I shared before some paper, some publications to show the different fish and the different amounts of mercuries they contain. We can find all of this online. You can search for it to satisfy, your curiosity as an independent individual. But the larger the fish, the more likely you get, the mercury exposure. The mercury exposure, some people have asked, is it because of the shining skin of the fish? No, it's not concentrated in the skin. So people say that taking the skin off because it's shiny, it may be the reason why they have so much mercury in this fish. No, it's not concentrated in the skin. It's actually found more integrated into the protein of the flesh of the fish.
Thank you.
So we gotta bear that in mind here.
Thank you. I appreciate you so much. So I think we should stick with our croaker because it's smaller, and the anchovies. I haven't seen that in years. So
but be careful though with the smaller ones. They are higher in purine.
Okay. What would we eat, Kwakwa? Now
No. Everything has to be done to moderation.
Okay.
The purine content of anchovies is so high that if you eat too much of anchovies, you will end up with gout. So you gotta be balanced in your exposure. Everything has to be done to moderation, because some people will say, if anchovies doesn't have mercury, then I can eat a lot of my anchovies. If you do, you have the other side of it. You will not have mercury, but you have uric acid. Uric acid deposition in the distal phalanx, that is the joints of the fingers, can be very painful. And the big toes and some of the smaller toes can be very, very excruciating. So it is best to make sure that you do everything to moderation.
Got you. Thank you. Dr. Ajibade, I have a question from Dr. Akintonde that's asked, does shrinking of the hypothalamus affect dementia?
I think maybe he meant hippocampus, because the hypothalamus has to do with the hormones. The hippocampus is the memory center. Yes. So if he meant the hippocampus, then the answer is yes. The hippocampus.
Go ahead, because I'm going to ask him to ask the question himself.
Yes. So the hippocampus is the memory center of the brain. It's like the relay center. It's what manipulates memory and directs which part of the brain the memories should stay, whether in the visual cortex or the parietal cortex, or whatever parts of it. So it's like the quarterback, the Tom Brady of memory. So yes, what was the question again?
The question is, if the hippocampus shrinks, does it cause dementia? He said hypothalamus. It might have been a typo. Dr. Akintonde, would you like to rephrase that question? Did he answer your question? That's what I should say.
Hello, I think it's the hippocampus. I had someone come to me and was talking about, did an MRI of the brain, a woman, and they were saying that, maybe I didn't hear what she's saying well. The hippocampus are kind of like shrinked. And then menopause, of course, was in with this particular patient. So I was like, okay, what did they say? And then the doctor didn't even go further to say they want to check for levels. They said, oh, you don't need any of your hormonal levels at this time. Something like that. That's what I was asking.
Yeah, there's no level to check, since, the scan had showed that the hippocampus had shrunk, like Dr. Ajibade showed us, the normal brain and the brain that has shrinkage. Areas, yeah. So once it's shrunk, Dr. Ajibade, I'm handing over to you to elaborate a little bit more on that.
Thank you.
Dr. Ajibade.
Yes, ma'am. So yeah, the hippocampus is, like I said, the memory center. So if it begins to shrink, and in some cases, this can be caused by all kinds of problems. Like I mentioned, the hippocampus is one of the most sensitive parts of the brain because it has a lot of work and it does a lot of things. So things like high blood sugar can cause the hippocampus to shrink. Things like stress, high cortisol levels can cause the hippocampus to shrink. Toxins can cause the hippocampus to shrink. Things that can improve the hippocampus include just memory problems and having to use your memory actively. Even reading can help to grow the hippocampus. There's a study that was done in London City cab drivers, and they found out because they have a very elaborate, comprehensive test before you can be a London City cab driver. They have to memorize extensive routes, and they found out that on average, the London City cab driver had a 17% bigger hippocampus than the average person because of what they had to do with the areas. So yeah, I hope that answers the question. Now, does it mean that a shrunken hippocampus automatically leads to dementia? I can't say that categorically, but it certainly can be one of the many factors that can lead to dementia. Like I said at the beginning, it is not only about memory. That's what the mistake a lot of people keep on making. They keep on saying, you think equating dementia with memory loss. There are some people who have dementia, but their memory is intact. They could have processing problems, they could have mood problems, they could have behavioral problems, but their memory is for the most part intact. So it's not just about memory problems.
Thank you. So driving a cab in London, then, it's very beneficial. People will not have dementia. I think once you consider that kind of job.
Maybe.
Yes. I didn't know. I'm going to put the word out. So Dr. Alu asked, are young people... Thank you. Your question was answered. She's thanking you, Dr.
Okay.
Okay.
Thank you.
So Dr. Alu asked, are young people in danger of dementia?
Yes. It's called early onset dementia, and the more common one, most likely young people who get dementia are most likely there's a very strong genetic component to it. And the most common type of dementia is what is known as frontotemporal dementia, which happens in your 50s. And some are even saying earlier than that. But even Alzheimer's disease, because of the massive amount of attacks and toxins we're exposed to in this day and age, we're seeing people younger and younger and younger getting dementia. The average onset for dementia is 65. So anything earlier than 65 is classified as early onset dementia. So anything over 65 is classified as regular or late onset dementia. So short answer, yes, young people can get dementia, and it is happening more and more frequently.
Wow. Thank you. Dr. Buka, my darling sis, please unmute.
Yes, hello. Oh, very interesting lecture. I enjoyed it immensely. And what you said, I've seen a few people, as my sister-in-law's relative had early onset frontal dementia, but he had a cousin who had disappeared years ago in Guyana, and they think she had dementia too early. So I've seen a few of those early dementias, and it is awful. When I say bad, he was so bad. This was a teacher, a principal. He would take you to the bathroom to see what his poop looked like. It's really bad when you see. The wife had a hard time with it. But he eventually disappeared, and he was found dead in a car. Mm-hmm. And he started less than about 55. But I just want to make a comment about exercise. I think we need to encourage our people to exercise more. I go to the gym, and believe you me, those women are there half an hour before, at least 20 minutes before, getting their spot. And I'm saying to myself, I'm always running late like a Black woman, running in and could never get a spot. So
you get there.
I get there. So
and eventually get a spot.
Like there, you should see their faces. There was even one day when one said, oh, my basement is flooded. I said, you came to exercise? Yeah, she was there. So these white women take it seriously when it comes to senior stretch. So since COVID, after COVID, I began to take it very serious too. Wow. So I think activity does help your brain, and especially your balance too with yoga. Mm-hmm. So that's a comment I needed to make. Thanks for allowing me. Mm-hmm. Bye.
Thank you. Thank you so much. Thanks for sharing that. And you know what, Dr. Buka, on behalf of the Medical Mondays family, I want to wish you a very happy 70th birthday coming up.
Thank you.
Can you believe she's 70? You need to see her in real life. She does not look it. I mean, she looks amazing. You can see, look at her. And in real life, you know, she looks even better, you know, better than she looks back. Very fit, finely toned at 70. So
Thank you.
congratulations and happy birthday.
Thank
I know
you.
it's been week.
It's the gym.
Happy birthday.
Happy birthday.
Thank you.
Ma'am.
Thank you, darling. Thank you, Mary, for wishing happy birthday.
You're welcome.
I have another question here from Clem. Can there be problem from too much vitamin D?
Yes, obviously, anything can be too much, but in my humble opinion, it is too the negative effects are way too exaggerated. In my humble opinion, I remember when I talk about this, I'm almost without exception. There's a doctor in the audience that says, "Oh, you have to warn them about too much vitamin D." Well, let's deal with the too little vitamin D first. Then before we warn them about it, the too little vitamin D is killing a lot of people, and if not killing them, causing there to be high levels of chronic disease, including kidney diseases, like what was spoken about last week. You cannot point to those same doctors who are always complaining, I'm talking about vitamin D. If you are to ask them, they cannot point to one single case of a person who died from vitamin D overdose. I'll say it again. Nobody in recorded history has died from vitamin D overdose. Again, but there are tons of people who have died from vitamin D. So to answer the question directly, and by the way, I mean, same WHO has said that vitamin D should not be recommended as a prevention for dementia. Can you imagine that? The same WHO has recommended that. So I have a little bit of a problem sometimes with, I can tell sometimes I have authority issues sometimes, but let me just answer the question. The vitamin D, the main concern with vitamin D, if it's taken too much, is that it can raise calcium levels in the blood. And in some cases, people may feel a little sick, they might feel headache, but as soon as they stop taking the vitamin D, give it a day or so, they're back to normal. So it's not that it can be that serious. Mayo Clinic stated on their website during the COVID-19 pandemic, but they've removed it now because, I don't know, somebody got to them. They say you can take as much as 60,000 international units a day for several months before you start talking about vitamin D toxicity. I only recommend 10,000 during the winter. So I think I'm pretty much safe. But think about this again. Your body, not during the winter, if you go out in your bathing suit, just trunks, you go out in bathing suit, it has been documented that you can make as much as 25,000 international units. In some cases, they've recorded in this lifeguards, they've recorded up to 50,000 international units. They're making it from just being out in the sun. So this hysteria about not taking too much vitamin D, in my opinion, is unwarranted. I think we need to err on the side of taking more than on the side of being too cautious and not taking at all, especially if you're Black.
Well, thank you, Dr. Ajibade. You knocked us doctors a few minutes ago that doctors, we don't care.
No, Doctor, I didn't say that.
You did. You say the doctors don't care, so take care of yourself. We do.
I didn't. Well, they don't care as much for you as you should for yourself, because they have a lot of other patients they're dealing with. That's just the truth. They can't come. Most doctors cannot go over all your medical records with a fine-tooth comb and say, okay, you need this, or what's your vitamin D? What's your vitamin B? What's this? They don't have that kind of time, but you should have that kind of time to do it for yourself.
Yeah, thank you. But actually, we do. We go over labs. When labs are ordered, we make appointment for the patients to come back to follow up. The purpose of that visit is to discuss the labs. And let me talk about me. I go over every single detail. If I have my patients on the platform now, please unmute and say if this is true or not. Vitamin D inclusive. When patients have vitamin D levels in the 30s, high 30s, 40s, even 50s, I tell them you have low normal levels. That's my language. Continue taking your replacement. It's very important. And I want to say that vitamin D deficiency causes high blood pressure. It causes multiple sclerosis. Multiple sclerosis, when people have it, they become paralyzed. It's permanent. I mean, so to say, the person has to be on medications. If they are lucky, they may be able to have function, but it's a lifelong problem. Once they develop multiple sclerosis, it causes osteoporosis, which is a bone disease that makes the bone brittle, so that people would have fractures without trauma, without falling or hitting themselves or something. The bone can just fracture. It causes low back pain. It causes constipation. These are all research proven. It's been linked to colon cancer. Everyone, go and look at the outrageous increase in colon cancer and in younger people. Vitamin D deficiency has been linked to colon cancer. It's also been linked to, sorry?
Especially Black people. The rise is mainly in the Black people. The rise in colon cancer is mainly among Black people.
And vitamin D is linked to dementia and depression, not just dementia. So it's very important. I'm not knocking it, but I'm saying that we actually are trying. An insurance company wrote me a letter about 3 years ago saying that they noticed that I'm checking vitamin D levels in my patients more than any of my peers. And I read the letter, I read it over and over again, and I'm like, okay, they didn't ask me anywhere to explain myself why I'm doing it, you know? And so I just ignored it because, I mean, what to do? I've got to do what is best for my patients, and I'm going to check what research is showing that if deficient could be a problem. And I'm not the only doctor. We have tons of doctors that are doing that, you know, when we realized that vitamin D is so important. So we appreciate you, Dr. Ajibade. Give us some credit.
Not at all. I'll give you credit, but you are an exception in many cases, in many regards, not just in doctor. And yes, there are some doctors who do it, but I can tell you for a fact that the vast majority of doctors do not do what you've just said.
That's a shame. So, Auntie Tower, you have your hand raised, ma'am. Kindly unmute. Welcome, ma'am. Kindly unmute, ma'am. Fantastic.
Good evening, everyone. Dr. Ajibade.
We don't see you. We see Tampa, man.
That's not Tampa. You can see me. If you want to see me, I have to log on my phone. Okay. Thank you for the presentation. That is wonderful. I have a couple of questions. For vitamin B12, is there a toxicity level for it?
For B,
I know it's water soluble. If it is very high.
Yes, like I said, all things have high levels. I've forgotten what the toxicity levels are, but it's much higher than what we think it is. I'm sorry, I didn't come with. I've forgotten that amount. I can get it for you maybe while we're talking. But yeah, there's everything at the toxicity level, but even at that level, it doesn't cause that I know of. Cause disease. It's the deficiency that is very dangerous, but the high levels are not that much. Like you said, because it's water soluble, so the body gets rid of it very quickly.
B12 deficiency also causes paralysis.
Yes.
And it's permanent. Yes, ma'am. You were going to say something else?
Then on dementia, is it reversible?
The official statement is no, it isn't, but in my experience, it absolutely is.
Yeah.
And there are doctors in this country too that are beginning to address it. And there's one doctor who has recorded over 3,500, and he's a neurologist. He's not a quack or fringe doctor. He has data, hardcore data, that shows how he addresses it, but he addresses it from several different angles, which is what is needed with dementia. The problem with the current approach is that we're all looking for one single drug that's going to be the magic bullet and is going to save us from all our problems. And unfortunately, there isn't any such drug.
Okay. And I have a granddaughter that fell backwards and her head hit the tiles and bounced back. She was taken to the emergency room because she started throwing up. They did the CT scan and they said she has concussion. So will that be something that we have to watch for continuously, or will it be just go back to normal with time?
So if you were my auntie, my mother, my older sister, anybody, I would say absolutely not. This is not the kind of thing you wait and see, because the brain is such a sensitive thing. Even if she doesn't display any, and I'm sorry to hear about it now. Is the child displaying any neurological deficits now? Is she normal? Back to normal?
It was only last week. Actually, she just went back to school today.
So my question again is, has the child showed any signs whatsoever?
No, except when it happened, she was throwing up, she was complaining of headache, and they said she should stay away from screen for 1 week. So she wasn't looking at TV or phone or anything.
Right. So the danger with this is that, yes, in some cases, again, because she's a child, how old is she? She's like 10 years old?
She is 10, exactly.
All right. So the danger with that is that, I mean, because she's a child, she can recover completely. And we've seen such cases. But she could have the fact that she's had vomiting and light sensitivity. To me, that's a very bad sign. And it could just go, and then maybe a year later, 2 years later, there could be issues can come up. There are different scenarios that can come out of this. So to answer your question directly, you need to be aggressive about doing things that can help to heal your granddaughter's brain. The brain needs to be healed and it needs to be repaired.
So what can we do to be aggressive?
I can't tell you over on this platform, because it's not a platform to give medical.
All right. Thank you very much. I appreciate you.
Thank
you. Yes,
ma'am.
Well,
Dr. Ajibade, you have your hand raised. You're muted, sir.
Yeah, every time we talk about vitamin D, I always want to remind everybody that you shouldn't just take vitamin D3 by itself. You have to combine it with K2. Vitamin D3, K2 combination is the best, way to get the benefit of vitamin D.
Okay, thank you. You have told us this before. Thank you so much, sir. It's a reminder. And you know what? I've been taking vitamin D. Today, I went to buy vitamin D3 and K2 because I knew the doctor was speaking and I expected it to come up. So I got mine again today. Thank you so much for that reminder. There's a question here that says, though no cure, but the process can be slowed down if detected on time. Can the process be slowed down if detected on time? The process of dementia.
Yes, absolutely. And it's best to aggressively slow it on time. Again, that's what we do. And the reason why I say I can't do it on this platform is because Dr. O said from the beginning that we cannot, this is not a platform for giving medical advice. But even if it were a platform for giving medical advice, from my experience, even just telling people what to do and just leaving them to go do it can be disadvantageous. Because from my experience, you've got to hold the person by the hands and work with the person to get results. You can't just say, just go do this, especially not for a brain condition. Now, if it's for a cut or a bruise, I broke my bone, I go to the hospital and have it joined back together. And that's a one-time thing. But when it comes to the brain, I got it. I've been doing this for almost a decade now, especially with severe brain disorders. Nothing just happens with a one-time thing or just a one-time, or just go do this and this. Once a person has a brain issue, it demands a lot of, like I said, hand-holding and step-by-step. Do this, what's the response? Okay, now do this next, now do this next, and get this next. It's got to be a step-by-step thing. Please don't, when we're talking about the brain, it is the most complex piece of bioelectric machinery in the known universe. It's just not handled in the same way you handle other conditions in the body. I'm sorry.
Thank you. So she further wrote that she read somewhere that if detected in the MCI stage and treatment is initiated, that it will slow down the process. What food types cause increase in amyloids? I don't know personally.
Yeah, so just to clarify, the MCI stage means mild cognitive impairment. So yes, what we know is that after about, if it's caught, that's the stage before it becomes full-blown dementia. And yes, there's a lot of things that can be done to improve the brain function so that it doesn't progress to dementia. And in fact, you can reverse so the person is back to acting and behaving normally. But in terms of food types that can increase amyloid, I guess she wants to know what to avoid so she doesn't have more amyloids. I think if I may say this, the more important question is what should you do so that you might discourage the formation of amyloid? And that's what we talk about in the Dirty Dozen. One of the most important things is sleep. We know stress can increase amyloid proteins. We know that excess sugar can increase amyloid protein levels. But having said that, simply having amyloid in your brain is not a guarantee. Even excessive amyloid in your brain is not a guarantee that you're going to develop dementia either. And again, that's my criticism. It's not just about the amyloid. It's not just about the amyloid. There are studies in which they've done a famous nun study, nuns, as in Reverend Mothers. And they found out when they cut open their brains at autopsy, they found they had a lot of amyloid in their brain. But throughout their lives, even unto the point of death, they showed no signs of cognitive impairment. So it's not just about the amyloid. It's about the nourishment and the health of the brain as a whole. And the more we know what it takes to keep the brain healthy and strong, and the more we provide our brains with those things, the more we'll be able to avoid this disastrous, terrible disease called dementia.
Thank you. Can dementia be actually prevented? Dr. Veronica wants to know.
Yes, absolutely. Those are things. That's why I came up with the Dementia's Dirty Dozen, because those are the main things that lead to dementia. And so, is that my phone? Oh, sorry about that. So those 12 areas, but the most things for Black people in particular, I think things I would definitely want to point out to. Sorry about this paper. Sugar. We Blacks, we love sugar, and we're the least likely to be able to. We have the least ability to regulate our blood sugar. That's just a fact. We're not as able to regulate blood sugar like we should. 2, we have the highest levels of cardiovascular disease. Over 80% of dementia has a cardiovascular disease component to it, hypertension and diabetes and so on. And number 3, we have the least amount of vitamin D. If you focus on those 3 things, blood sugar problems, cardiovascular problems, in other words, you need to ensure that your blood pressure is normal. Don't joke with it. 130/80 is what they're saying now, not just 190/140.
120/80 or less. People keep forgetting that, or less. 120/80 or less. When you're at 130, you are already stage 1.
Okay. So 120/80, your blood sugar or less. Once you do it, it's your less, your blood sugar and your vitamin D. Those are the three things Black people should pay attention to more than anything else. If you can control that, that will put you in good stead.
Fantastic. Thank you. So,
sorry, Dr. Ajibade. Sorry, let me
Yes,
just kind of say something about that. There are studies going on. Some of them are animal studies. The result is that, food or nutrition high in high saturated, fatty acids, lipids, and cholesterol do predispose the animal to having increased amyloid formation in the brain. So, and any food that is low, any diet that is low in fruits and vegetables will also predispose people to, high formation of amyloid.
Thank you. That is very helpful. That's very helpful. Thank you. So, Dr. Veronica, I'm very sorry. Dr. Ajagbe, I think, interjected because of the correlation with what we were talking about at the moment. So, Dr. Veronica had her hand raised, and she also had written, what do we eat and do to boost our vitamin D? Was a question she had asked in the chat box. So, Dr. Veronica, unmute, fantastic. You can ask a question.
All right. Thank you, Dr. O. And thank you, Dr. Ajibade. Thank you always, Dr. Ajagbe. I appreciate the interjection. I just thought I would just put the question on the kidney. But on the response to prevention, is it the same action when it's a family genetic trait that you can see that's happening in generations? Is it a more aggressive? Is it even preventable when it's genetic? When it's not just by your nurturing and social behavior?
Excellent question.
Thank you, Doctor.
Okay, yes. So the saying goes that genetics loads the gun, but it's lifestyle that pulls the trigger. And so, yes, genetics put you in a vulnerable position to have dementia, especially if there's before I don't want to get involved in the technical aspect, but you can have genes from both parents and it make you very, very strongly more prone to having dementia. But even at that, a typical example is Chris Hemsworth, the guy who plays Thor in the Marvel Cinematic Universe. He has been shown to have the genes for Alzheimer's dementia. So he's taking a break to be able to get his life to take care of his health. But even at that, there are things that you can do to significantly reduce your one's chances of developing dementia. And I particularly mention these things for Black people because I don't want to overwhelm people with all these different things you need to do. The three most important things, if this person is a Black person, three most important things, I've mentioned them. Those I can conveniently say that over 80% for Black people. Now, there are other things like toxins and the hair care products, like I said, and all that. But these three things will put you in good stead. So like Dr. Ajagbe said, eating fruits and vegetables, taking healthy meals, avoiding especially fried foods. Again, we Black people love fried foods. And fried foods can cause a lot of damage to nerve cells and the brain if we take it a lot of the times, especially with junk food. So these are just the common sense things that we need to do. But if I or someone I love had the genetic predisposition, I would be maxing out my vitamin D. I will be ensuring that my vitamin D is closer to 100, for sure. Still within the range. I would be ensuring that I wouldn't just. It's not just enough just to have good blood pressure. That's not enough. You've got to be taking things that would specifically improve the health of your arteries. I've done a few talks on cardiovascular disease here, but the key thing is nitric oxides. Nitric oxide is a gas that the blood vessels produce that help to open up and dilate the blood vessels. But nitric oxide is absolutely key for brain function and synaptic transmission as well. So I will be taking supplements that significantly boost the production of nitric oxide. And like I said, vitamin D, nitric oxide. And then, like I said, we're working on a combination supplement that has all these different things, especially geared towards the Black person. So stay tuned.
Yes. And making it reasonable in price, right? So it's
Correct.
not expensive when you
Yes.
come back to it. Dr. V, was your question answered?
I was just going to jump in. Thanks for letting me say that. Thanks a million. I think a lot of people are waiting for any products that you have because we trust that we won't worry about preservatives and all that, which is why I stay away from supplements. Is preservatives. I don't know if we should worry about that. Thank you, Dr. O, Dr. Ajibade, and Dr.
Thank you.
I think you should worry more about not having the nutrients that your brain needs than worry about preservatives.
And the supplements.
Thank you.
Then okay, yeah. So as far as what do we eat and do to boost our vitamin D? I think Dr. Ajibade has said it over and over, we should take the vitamin D. But there are foods that are rich in vitamin D, correct?
No,
well,
zero.
Well, we have the tuna, the salmon, the mackerel, but are you going to eat truckloads of them is the thing. You can't. So I can see why you say zero. I'm with you on that. But, you know, they're not going to give you the replacement you need. Is that what you're saying, Dr. Ajibade?
Yes, ma. It's not even close. I mean, I don't get it when people say that you can eat some, you can get your vitamin D amounts. I mean, whatever is in food, nature did not equip us to get our vitamin D from animals or plants or from any kind of food. Nature equipped us to get our vitamin D from going out in the sun. And when that is not available, there is only one other alternative. None comes close. So please, food is not the answer when it comes to vitamin D. I'm sorry.
And going out in the sun, if you're my patient, I would have advised you to please, when you're going out in the sun, whether you're white or black, that you should put on your sunscreen. Because I want you to protect yourself and shield yourself from the sun so that you don't get skin cancer. So coming back to that, and you know, when you're black, you have that you have melanin in you that confers the black skin that makes your skin so black and beautiful that it doesn't wrinkle, but then it shields you from the sun. So still, I'm saying wear your sunscreen. So coming back to it, I'm going to agree 100% with Dr. Ajibade that take your vitamin D.
And the good thing, just a quick jump in, and Dr. Ajibade mentioned a very good point, vitamin D3 and K2. Yeah. The challenge, and I always mention that as, I mean, I don't always mention it, sorry, because Dr. Ajibade had to correct it. To get vitamin, I try not, so I know some people, once they go online and look at vitamin D3 K2 combination, we're talking about an average of about $30 or $40 to get
$21. I bought one today. $21 for 30 days.
For 30 days. What was the dose of the D3?
Sorry, it's downstairs.
So the one I recommend is it has a D3 K2, D3 of 10,000, K2 of 100 mcg. So that's the ideal combination. They found out that works. That costs about $34 to $40. Once you start telling people that, as opposed to the D3, which is like $10 can last me 6 months, for example. So the danger is that when some people say, okay, let me wait until I have money to buy the D3. And then they don't take the D2. So they wait until they can have money to buy D3/K2 combination because it's more expensive. And in doing that, they not take the D3 at all because they're waiting for me to have enough money to buy the D3/K2 combination. And so I always think good is better than best. It's better to have D3 on its own if you cannot afford the D3K2 combination, the best is to have D3K2. Dr. Ajibade, I totally agree with you. Best to have D3K2. However, many people are not able to afford the D3K2 on a monthly basis. So the D3 is what I say to start with. Yes, sir. Doctor, I can see you're showing your product. How much is that? You're muted.
Yeah, you're muted.
This one is available at Costco for those who have membership. And I think it's less than $30. I think it's $21 or $25. But it has...
What is the international units of the D3 there?
Yeah, the D3 here is 5,000.
Okay.
So I think 5,000, is okay. I mean, particularly for those who already have vitamin D by itself at home. So you can do a combination. If you already have vitamin D3 at home by itself, 5,000. As Dr. Ajibade is suggesting and recommending, that, 10,000 international units will be adequate with the combination. So I just wanted to share that because another person has, private chatted me to find out what the dosage will be, what the content should be. So
thank you. I will let you know if I get the dose of the one I got today for $21, and it was a giant. So I'll let you know in a bit if I get it. So Clem says, thank you for the answer on too much vitamin D. My takeaway from your presentation is to do an annual test to check the levels. If you don't mind, I want to answer that question. It's actually every 3 months. I check vitamin D level every 3 months, along with if somebody has diabetes or they have hyperglycemia, which is increased risk for diabetes, or, high cholesterol. I will check it every 3 months, those three. I don't wait a year to check it. And the vitamin D3 that I got today, it didn't have a dose. That's interesting. Or the dose is on the other side. I have another one sent to me. This is interesting. Look. D3 plus K, the nature made. Okay. I'll revert back again. So that's what I do. And she wrote, Dr. O, you are not the average doctor because you care a lot. Unfortunately, from her observation, a doctor doesn't have a time, and that's why she comes here, because we care for our people. Thank you. We appreciate that. Thank you. Because, it's great to know that we are all benefiting. We too are benefiting with that, presenting. We are learning a lot. Appreciate you. Gifty said, with birth control having estrogen and progesterone, or progesterone only, since estrogen has been shown to help with neuron connection/processing, is there any statistics on women that have been on birth control and their onset of dementia compared to women that haven't used birth control? Have there been studies to see if hormone replacement can help prevent women for dementia? Dr. Ajibade.
Yes, definitely. That's a great question. So some of the studies they've shown, and just as a writer, as a quick note here, that there are various aspects of approaches to using birth control. and hormone replacements. So birth control is one thing, hormone replacement is another thing entirely. So I don't know if she's referring to hormone replacement.
The birth control pills have it's the hormones they have in there, the estrogen and the progesterone, and they delivered at different times to prevent pregnancy. So it's just regulating those hormones to not achieve pregnancy. That's what birth control does. And that's what she's alluding to, that since women take these hormones to prevent pregnancy, is there any study that has shown that women who have been on birth controls, on hormones, compared to those who have not, if one develops dementia more than the other?
So I don't know of studies with regards to birth control, because I'm assuming that if you're using birth control, you're in your 30s and 40s, maybe
20s.
Yes. So
teenagers, they start from 13 now.
Right. So no, I'm not aware of any studies with regard to women at that young age. The studies I'm aware of are those who are going through menopause and they're using hormonal replacement therapy to control their symptoms. They've also found out that because, again, it has to do with estrogen levels, they're able to delay the onset or even reduce the risk of having dementia because of their providing the estrogen. But on the contrary, if there's no intervention until about 10 years after menopause, and the person is not having dementia-like symptoms, and they try to give them the estrogen or give them the testosterone or progesterone, they have found that to be not as effective and in some cases harmful in that case. So I know I'm not answering your question directly. Well, I think I am. I don't know of any studies with regards to birth control.
There are no studies that I know of on oral contraceptives and dementia, like you said. There are studies on cardiovascular disease and even cancer with oral contraceptives, but not that I know of. So
yes.
Thank you. Thank you.
Thank you so much. He answered my question.
He did? Fantastic.
Yeah.
Thanks, Gifty.
Thank you.
So my auntie Susan Oshifade said K2 is present in beef liver. Enjoy the dish often. Great knowledge in dementia. Thanks, Dr. Ajibade. What are the early signs of this disease of dementia? She asked.
Okay, yeah, sure. So I volunteer with the Alzheimer's Association. As I said, there are 10 classic warning signs. I hope I can remember them. One of them, obviously, is memory problems, wondering about not being able to navigate back home, for instance, and that's why you have to use Siri or use Google Maps, whatever. Mood problems. Sometimes you're not as stable. And I see some of my patients too. They are normally level-headed, mellow people, but all of a sudden they fly off the handle too easily, or they get upset so easily. Another one would be not being able to make a decision, not being able to balance a checkbook. You're not able to do your numbers like you should. Not being able to recognize faces. In some cases, there are balance problems, like the cerebellum, the small part of your brain, is responsible for balance and cognition. So there might be some balance problems. There might be some perceptual problems, delusions. I'm seeing things or hearing things that actually are not there. That may be more in the late stages, but in some cases, there are some perception problems that happen earlier. Let me see. I don't remember all of them. But usually what the key thing people say you need to pay attention is if someone has a change. This is a 70-year-old person who is normally maybe a well-organized, tidy room, and then when next thing you come to their room is just clutter. They're not organized, and this is not unlike the person. That should prompt you to say there's something going on here.
Auntie, is your question answered? Thank you so much, Dr. Ajibade, because you went through the broad spectrum of dementia. The Vitamin D3 K2 that I got is 5,100, just like Dr. Jagbe's, and it was $21 at Giant. So it's the same dose. And you know me, I love that 5,000, you know. Let's keep it real. I didn't even look at it when I bought it, but fantastic. So I think somebody called me, I think.
Yeah, I did.
Fantastic. Go ahead, ma'am.
Previously, when Dr. Ajagbe prescribed the K2, I had found it at Costco, but I couldn't find it anymore. And I went to CVS and whatever, but all I found at Kaiser was a K1. Would that also do temporarily until I'm able to find K2? Because,
no, it's combination D3 plus K2.
yeah, but it's not, when you don't have that combination.
K2 does a completely different thing than K1 does. K1 is meant for coagulation. It improves your body's ability to form clots. You do not want that, especially if, as a Black person. Blacks have greater tendency to clot than white people do. So don't take K1 unless your doctor specifically ask you to do it. But so please, that is not a replacement for K2. They have very different functions.
Okay. I'm glad I
got mine at Giant here. So I think maybe any store.
Yeah, I went to CVS. I couldn't find it, but I'll hunt for it.
If you can't find it, ma, please let me know.
Okay.
And yeah, take care of that. So I have a question. I have lots of, thank yous, Dr. Ajibade. You've really blessed so many people on the platform, and lots of happy birthday wishes to Dr. Buka. Thank you, Medical Mondays family. But Faith is asking a question, wants to know Dr. Mike Oye's view on how to mitigate and prevent dementias naturally from the naturopathic doctor's point of view, from the naturopath. Sir, kindly unmute, sir. Faith wants you to chime in on this, sir.
Thank you.
Prescribe Ewuro. That's it.
Ewuro.
Can you hear me?
Yes, sir. We can hear you, sir.
All right. I think just to add to what many people have suggested, and thank you, Ajibade, that was really great. We need to consider some important herbs that are like food to the brain and the nervous system. These include moringa. Moringa is all-purpose for every part of the body. It's a miracle tree. Okay. There's another plant called igi fruit, Terminalia catapa. Do we know igi fruit?
Fruit.
That's Indian almond in Nigeria.
Indian almond, yeah.
Indian almond. Yeah.
The leaves. The leaves are very rich in nervines that are able to repair both the gray matter and the white matter. Then there's mistletoe. I just want to mention them quickly. Mistletoe grows on cocoa, on oranges, and so on. It's a parasite. The fruits are poisonous, but the leaves are wonderful.
Leaves, okay.
Then there is nettle, stinging nettle. Then there's ashwagandha. There is Cutelaria, that's skull cap. Then there is Passiflora, passion fruit. Both the leaf and the juice. Then there's Brazil nut, particularly for B12. Brazil nut. And if you are going to use Brazil nut, you don't take more than one nut per day. If you take more than that, it's overdose.
I've been eating two, sir.
Don't eat two, eat one.
Yeah.
Then, of course, somebody has mentioned already the importance of vegetables and fruits generally. Please don't forget every part of coconut, both the juice, the flesh, and the oil. I'll end there.
Thank you so much, sir. Much appreciated. And how do you do this? Whatever one you get, or
you use most of them as tea.
As tea.
You use most of those things as tea.
Okay, sir. Got you, sir. Thank you, sir. We appreciate you, sir.
Thank you.
Thank you.
Walnut is another thing to add to that.
Sir?
Walnut.
Walnut. Oh, walnut. Oh, thank you. Thank you. Actually, if you look at walnut, when you peel it,
yes, it looks like brain. Looks like the brain.
That is what we call what? Signature.
Right.
Mm-hmm. Nature speaking to us.
Thank you so much.
Both the European walnut and the African walnut, both of them.
Mm-hmm.
Thank you, sir. How available are these herbs? Are they readily available in like places like Costco?
Very available. Very available. Most of them are available in Nigeria.
Like in the marketplace, you mean just go to the market and just get them in the market?
Well, you don't even need to go to the market. If I tell you about Indian almond, you'll be surprised. It grows all over Lagos.
Yes, now.
Almost every rich man has got it on his compound. Yes. Every school, every church, every public place.
So people just need to know, to be aware of
it is the knowledge. It is the knowledge which is important. Yeah.
Awareness.
Yeah. Awareness. Yeah.
Very good. But the thing is that they have to use it. It's not so. My challenge many times when we talk about herbs is that
there are regulations. There are regulations. There are measurements. Even measurements.
That's that too. But to get the benefits, it's not just a one-time thing. It's something that you have to, like, for instance, I think about vitamin D. I know that for the rest of my life, I need to take vitamin D. So is that, people have to realize that if they're going to choose one thing, let's say the Brazilian nuts, for instance, to get the brain benefits, they have to use it for the rest of their lives. Am I right? Or is it just a one-time thing?
It's okay. Just like we eat every day.
Yeah.
It's part of our food.
So they have to be committed
to our food.
But they can't take everything you just mentioned, obviously.
No.
You have to take one or two.
Only one or two. You take only one or two.
Yeah.
And you can vary them from time to time. Just like you take Eba today, tomorrow you take Iyan, the following day you take Amala.
Yes, sir.
The awareness is very important.
Yes, for sure. For sure. Thank you, sir.
Actually, I've just written a letter to one of the state governments in Nigeria. If they will allow me, I will teach people many of these simple things which are surrounding us, and we are dying. God has provided so many raw things around us to supplement what we get from hospitals and so on. And there are many places where we cannot even go to hospital at all, and we should depend on these things. Personally, I depend on these things, and I am very strong and healthy.
In his 80s. So, Papa, Sherifat Olayinka asks, what names are they called in Nigeria, sir? I think fruit is fruit. It's called fruit. The one Dr. Jagwe elaborated is Indian almond. Moringa is moringa. We have moringa. It's moringa.
No, moringa igi igbale. Igi igbale.
Oh, okay. So
that's my sister, Dr. O. That's my older sister invited to this forum.
Oh, welcome, Ma.
Mrs. O,
Okay.
thank you for joining.
You know what? Oh my gosh. Please private chat me with your number, and I'll get these names from Papa and get them to you, and give you Papa's number also, so that you can directly link to him to ask further questions. So if you private chat
Actually,
me
I have many of those things right with me in my lab.
Oh wow. So kindly private chat me, Ma. Auntie Cherry Fats. Thank you. Thank you for joining. So thank you so much, sir. This was fantastic. So that for people from, back home who are on the forum listening and, can possibly get this like vitamin D3 and K2, because I don't think we have that in Nigeria. They will be able to, do the natural stuff. And since you have gotten results, this is fantastic.
Dr. O.
Yes, sir.
Can I share the screen to show the vitamin D, the one I just showed?
Yes, you can.
Let me see if I could share the screen so you can see. 1 second. Hold on 1 second. Let me just be sure. Hi. Where is this? Okay, there. Okay. Can you see my screen? No?
Yes, we can.
So this is the one in Costco.
Yeah, you showed it to us already.
Okay, so for anyone who wants to do that, go to Costco, have membership, I think they can still get it from Costco.
Okay. Okay, thank you.
You're welcome.
So, Dr. Ajibade, before you give us your closing remarks, Medical Mondays family, I would like to share with you the result of our fundraising for Francie. So, Dr. Jagwe, please, if you please stop sharing.
I'm trying to. Okay, that's fine. Stop share. Okay, good.
Thank you. So, I want to thank Medical Mondays family. I want to thank NAPAC and Nigerian Center for showing up. NAPAC took the lead here for this young girl. And I'd like to share what has happened, what we have done. If I can see my share button. Let me see. Okay. So And I don't know what just happened here. I don't think you can see my screen.
We can.
You can?
Yes.
I brought something else up. Okay. I don't know what happened. Why my Zoom is like this. But you can see my screen.
Mm-hmm.
You are sharing from your email right now?
Yes, I'm sharing from my email. Thank you. That was what I wanted to do, but it's not, it didn't open up all the way. Okay. You can see my screen. So when
Perfect.
we asked for donation, we asked that Francine needed $6,500, and that was what we were looking for. We had started donating before we did that. The total amount she needed was actually $14,701, and we had donated. She had also paid $6,000 to the school before then. And I want to show you that. So I started this donation December 15, I think it was. Anyways, you will see the donation here from December, what we donated through Zelle. She got $450. And Mr. Gbenga Motayo in New York, the chair for NAPAC in New York, loaned her $2,000 with, she came up with $3,550. For people who have been nagging me, why can't she work? Can she contribute? Well, she did come up with, she cannot work as an F1 student, but she came up with $3,550, and she cannot work because she couldn't find a job on campus. As an F1 student, you're allowed to work 20 hours on campus. There are no jobs. It's a small place. So she gave this $6,000 to the school in early January. But because the deadline they gave her before then was over, they told her she has to come up with the 8,701 remaining. And GoFundMe had been set up. You will see the people donated through GoFundMe. I'm increasing. Good. I know how to expand this now. You'll see Madam Lara Okunubi, Miss Yeti Milano, Dr. Veronica, Dr. Saon, Mr. Okusonya, then somebody anonymous. The total donated was 1,070. They gave her 1,033. I think they took about $38 from there. That was the donations from GoFundMe. So we had to come up with the 8,701. Some people donated already before we brought it to your knowledge. So by the time we brought it to your knowledge, we had 6,500 left to contribute. And these are the people who contributed. If you don't see your name on the list and you contributed, please let me know. The reason I said that is because people who donated through Zelle to Nigerian Center, they are able to put there in the memo section that they were donating to Franzi. People who donated through the website, and because they now have Act Blue, we're not able to put a memo as to what the money is for. So if you let me know, I can have Nigerian Center search for it, and then they can add the money over here. But these are the donations that we had. You please pay attention to number 33 and 34. That's a dear friend and brother of mine who gave me $5,000 for her. Give me peace of mind. And those are the monies that were donated. So in summary, so far, from the time we talked to you, on this list that I showed you of 39 people, we were able to raise $9,264. When we took out the $6,500, we had $2,764 left. GoFundMe, $1,033. So taking out what we needed to pay, she would have $3,767 left. And she's going to pay back the loan that she was given. And I think the loaner is going to donate to her. And so she would have, we would have $1,779 left, maybe plus another 200 or 250, and we would send that to her. We are in the process of sending this to the school. Coincidentally, the school is just now telling her that we need to hear from you or else. So we have the money, and I want to say thank you. It's not only the money we have. Somebody at an attorney, one of us, reached out to ask if she needed accommodation that none of us thought about, and she needed accommodation. So she was able to get a place. She has moved to the place where and is furnished that she can be till May. So I just want to say thank you to everyone who has donated, and people who thought of donating, and people who, things are going on these days. To even reach out into your pocket to donate something is huge. So for people who are not able now, we're still family. Thank you to everybody. Thank you so much. Do you have any questions so I can answer them before I put this down? Any questions? Okay, thank you. So, Dr. Ajibade, I'm going to defer back to you to give us your closing remarks.
Well, thank you, Dr. Sorry, go ahead.
Thank you. Go ahead. Go ahead. Thank you for speaking, because then my screen got back to where it should be. Thank you.
Well, Dr. I have to commend you for the lead you took in raising money for this lady and helping her in every way. That's just fantastic. It shows what people can do when they have, and everybody wants to do something good. It just sometimes we need someone to take the lead. And so thank you for taking the lead and sparking this wonderful work that you've done for her. Really appreciate it. I think everything has been said, and I thank you, Dr. Ajagbe and the other people who have contributed with their comments, and Dr. Mike Oye, of course, and everybody else. I just want to reemphasize what I said earlier, that the brain is not like any other organ that will just heal by itself and you'll be fine. It's very important to take a very, very, very aggressive approach. Especially, I'm just thinking about the lady whose grandchild had a knock. It can always go one way or the other. I mean, hopefully it goes the right way, but there's no guarantee. So I always say, please be aggressive about maintaining your brain health and learning more and more about what to do to maintain your child's brain health. We are trying our best to really address dementia in the Black community. By the way, I was featured in Baltimore. They have the Baltimore magazine called Game Changers, Baltimore Game Changers, people who are doing a big thing in the community. So I was interviewed for my work with the Black community. That magazine is coming up in June, so we'll look out for that. But Black people have to take a special care of our brains, because we are the most vulnerable. Our brains are the most vulnerable. So thank you for giving me a platform to talk about this.
Thank you so much. I cannot thank you enough. This subject is very important. And we're bringing you back again in the future, because we have to continue the dialogue. Even though you have educated us about this in the past, you see how much we learned again. Thank you. Appreciate you. Somebody is asking if Papa Mike, I think that's Dr. Alu, checks his number. I don't understand the question. Dr. Alu, what do you mean?
I'm so thrilled. I'm so thrilled with the way he goes about this natural herbs and the way he looks so healthy. So I'm just wondering, looks so healthy, and at this age, he doesn't use glasses, and I'm just wondering, no.
So yeah, you were wondering if he checks his number.
Yes.
It does. I actually personally check his numbers. I've checked his numbers. Yes. You mean labs, right?
Yeah. Awesome. Awesome.
Yes. It looks fantastic. Thank you. Dr. Veronica, she once shared with Dr. O. I don't understand.
Sorry, the publication that Dr. Ajibade talked about, I'm one of the curious people. I want to read it. So I wondered if he could share it with you when it's published. And Dr. O is an amazing resource. I know we'll all get it. Thank you.
Thank you. Dr. Ajibade, would you share it, please, when you get it done?
Yeah, absolutely.
Thank you, Dr. O, always.
Thank you so very much. Medical Mondays family, you rock. You are amazing. And from the bottom of my heart, I say thank you for who we are generally, everything. Thank you. So I want to encourage us to keep safe. I'm still seeing COVID. Can you imagine? So let's keep safe. We meet